So I am here today with Dr. Darrell Kirch, who's become not only a colleague, but a friend of mine over the years. And it's a pleasure to have you here, Darrell.
The pleasure is mine, Seth.
So I'd like to start out by just talking a little bit about your background. Like if you could just give us a kind of a high-level sense of your career trajectory and some of the posts that you've held that are germane to the Stop Stigma Together work that we'll be getting into later on.
You know, I think for all of us, there are two facets to our background. There's what the public sees, and then there's what our private life was like. I grew up with parents who were part of the greatest generation, and while they did not have much education, they instilled that in me and my brothers. I was fortunate that we were back in the years when public higher education was actually affordable. And so I was able to go through undergraduate, medical school, and all my residency training at the University of Colorado. I really didn't have mentors, but I was intrigued by medicine. And when I got to medical school, I was especially intrigued by the brain. Went into psychiatry as my specialty training program, and was fortunate to have a mentor who was he was very junior then, but he was on the cutting edge of bringing American psychiatry back to the brain. American psychiatry had become very theoretical and psychoanalytically oriented, but at the end of the day, he and others believed strongly that the basis of behavior was fundamentally in the brain, and we needed to understand the brain better. I did research with him. I became interested in an academic career. I was able to go off to NIH, the National Institutes of Health, which is arguably the world's greatest concentration of medical research, located outside DC. My 2-year fellowship ended up lasting 13 years. I became deeply interested, especially in schizophrenia, just a devastating brain-based illness. But I also picked up various administrative responsibilities. And no one was more surprised than I was when I was asked to consider becoming a medical school dean at the Medical College of Georgia. I was especially surprised when I was accepted to the position and was there for 7 years, really came to love the whole process of medicine, healthcare, educating the next generation, discovering new treatments, cures. Loved what I was doing, took on that role then at Penn State University, where I also ran the health system. So I was on the front lines of seeing how the American healthcare system works, and it is the best medical technology, the best pharmaceuticals, the best in the world, but the system struggles, as we all know. I had a front row seat of that, and then had become involved in the National Association for Medical Schools, pardon me, and their teaching hospitals, and was selected to be the president and CEO of that organization from 2006 to 2019. That really brought us full circle to you and I meeting, because one of the things I've become very interested in was the mental health of America's doctors, nurses, and other clinicians. This was before COVID, but there were a lot of emerging signs of great mental health distress and burnout among caregivers. And if the healthcare workforce is burned out, it's not good for the patients. So I took on that project in partnership with a colleague who leads the National Institute of Medicine. And you provided us some key guidance, because bringing the burnout, the mental health struggles of clinicians out of the shadows where it had been forever, into the daylight, really attacking it as a problem, fit your work in grand challenges. And so you and I intersected around that work, and you helped us really accelerate the work, which goes on today. I was at a meeting earlier this week about the initiative. But that intersected with another serendipitous event. A colleague with whom I'd worked way back at NIH decades earlier was being recruited to lead a new mental health institute modeled after cancer institutes, a sort of full spectrum approach to the issues of mental illness and mental health and substance use disorders. The donors that were supporting that initiative really wanted to take on the tenacious, thorny issue of stigma around mental illness, substance use disorders. They wanted to mount an effort against stigma. There were grassroots efforts around the country, but there was no full-throated, full-fledged assault on stigma. And it immediately appeared to me that that was another grand challenge, not unrelated to the grand challenge of the mental health of clinicians. And clinicians face a great deal of stigma around their mental health struggles. And you happily were willing to take on leading that grand challenge against stigma, which with the support of Mark Rappaport, who heads that Mental Health Institute at the University of Utah, and your leadership of the Grand Challenge, Stop Stigma Together, has grown by leaps and bounds.
Well, thank you, and I want to get into that. But before we begin talking about the kind of what it's been like to work together on Stop Stigma Together, I'd like to also ask you to share a little bit about your personal commitment to eliminating stigma, because that's something you've shared from the stage more than once, as well as in private conversations that we've had around why this is so important to you and why you're willing to dedicate so much time right now to it.
You know, I talked a bit earlier about our public persona, what people see. And if people read my resume, they would say, well, that's been a wonderful, seamless, successful career. But the personal reality is actually much different. I, in some ways, had struggles from the very beginning. My mother had a terrible psychotic postpartum depression right after I was born. I know there was a lot of disruption in my life during infancy. And I grew up as a terribly anxious, actually a socially phobic, school phobic child. I went through a lot of periods of childhood depression and anxiety, but that was in the 50s and the 60s when really the mental health of children especially was not a front burner topic in medicine and health. I never received any formal kind of help with that. And yet I was fortunate to be a good student, and I pushed through academics and even made it into medical school. But during my first year of medical school, I really was hit with overwhelming panic attacks followed by severe depression. And I decided that dream of a career in medicine was a bridge too far for me, and actually sought to drop out. But it was an empathic professional, in my case, my student affairs dean, who recognized that I had a clear-cut psychiatric issue that was amenable to treatment. He steered me he refused to let me drop out until I tried treatment. The treatment was fairly effective, and I realized it's no coincidence that that happened in medical school, and then I chose psychiatry as a career because my own brain had become my own worst enemy. And yet I realized that there were effective, increasingly effective treatments for things like panic disorder, depression. So those were seminal events. Now, when you have scars, like the disruptions in my life in childhood, I also sadly was a victim of childhood sexual abuse. at the hands of a loved one. Those do leave a mark. Uh, there's a famous book called The Body Tells the Story about how, especially early trauma, can have long-lasting, lifelong health impacts, mental health and physical health impacts. So it isn't that those things are gone and in the past for me. I remain on an antidepressant until today. Antidepressants have been proven to be very effective for both panic disorder in some cases and anxiety. All that said, I got involved in the broader field of healthcare. But as I stepped out of my final full executive role heading the Association of Medical Colleges, I was able to return to my passion about the brain, about mental health, and about the struggles people experience. And so being able to work on this challenge of clinician well-being, being able to work on the challenge of stigma, have really provided me with capstone activities at the end, well, hopefully not the very end, but in a later chapter of my career. So it's that intersection. I think it's always important when you work with people to understand that whatever you see about them on paper, there also is a real person with a real history behind that. And my real history was very tied up in mental health struggles and with stigma. I never revealed my struggles until 2019, when I first spoke publicly to a large group of people about my own mental health struggle. And I realized that what kept me from doing that was stigma and the societal attitudes that tend to diminish people who struggle with mental health issues. And I fell victim to that fully. I'm now trying to correct that a bit with the work we're doing together and the work I'm doing on clinician well-being.
Well, it's powerful and beautiful. I remember when we first met in that work on clinician well-being, in my work in Grand Challenges, I am almost always thrust into a sphere where I am not a subject matter expert. And so here I was talking to people who were running multi-billion-dollar healthcare companies, high executive staff in the AMA and other organizations. And I was looking for someone that I could go to and say, okay, here's what I'm hearing. Am I hearing it right? Is this making sense? Am I getting what they're saying? And that person became you. And I felt that you were very warm and approachable. I felt not judged by you. I felt like I could come to you and say, I don't understand what this is. Give me some background here. And you did. And so I felt a very warm relationship with you. I really appreciated that. And then when you contacted me, after you had become executive advisor to Mark Rappaport, for me, that was a welcome connection, not because of the work that I envisioned ahead, but because it was you. And so I think also, as you talk about how there's a human behind those CVs, there's also relationships behind work. And those relationships are very important to me.
It's so interesting. The work on Stop Stigma Together with Dr. Rappaport and the Utah Mental Health Institute, all really was getting started in the midst of COVID, which has been, I think arguably it's been the greatest disruption of relationships and health in our lifetime. And so timing is everything. And sometimes a crisis can be used for good. COVID created not just the infectious disease crisis, but a true global mental health crisis that I think will reverberate for years to come. But it did, I believe, accelerate our work around mental health and bringing the issues out of the shadows into the mainstream so that more people can seek help, access the treatments that are every day getting better and better.
Yeah. I feel like that this window opened, at least in America, between the pandemic and Simone Biles stepping away from the Olympics for mental health reasons. Suddenly, it was on the front page of the newspaper, New York Times, LA Times, Washington Post, Wall Street Journal, almost every day. A new athlete, a new celebrity, a new challenge. I know I have in my personal contact list about 150 CEOs, and many of them I'm in contact with regularly, and I saw them start to ask questions and say, okay, I need to create an environment in my organization that supports the mental health of my staff and either our members or our customers. And I don't know how to do that. And I'm scared. And I'm afraid that if I open the door and people can suddenly start talking about substance use disorders or anxiety, that their work programs will unravel and that our performance will falter. And I know I need to do this, and I don't know what to do. And I saw that everywhere. And to me, that said that a window is opening and there's an opportunity here. And that coincided with the work that brought us together for the second time, that eventually became known as Stop Stigma Together.
I don't know if you happened to see it, but somebody at the meetings I was at this week passed on to me a recent USA Today insert, I think it's 8 or 10 pages long, full pages of information about the prevalence of mental health issues, the availability of treatments, advances in the science. And the very last page emphasizes the importance of peer-to-peer support and building healthy relationships in the workplace and at home. So I don't think that would have happened a decade ago, that we would have seen that kind of focus in a major national publication.
That's wonderful. So let's talk about Stop Stigma Together. That's the grand challenge that really brought us together and put us in the trenches. And I think we're entering our 4th year now with Stop Stigma Together. But let's talk about the early days. You called me in to meet with Mark, and we had conversations. Do you want to share your perspective on that?
Well, I called you out of desperation because I will say quite honestly, when the early discussions about really mounting a national campaign against stigma came up, I really thought it might be too big an issue to take on. I mean, the home organization was just getting itself started. A new mental health institute. It was really trying to find its bearings. As I mentioned, it had been conceptualized as being like one of there are now over 40 comprehensive cancer institutes in the United States, sanctioned by the National Institutes of Health. There's no analog for mental health and psychiatry. So just the sheer notion of starting this kind of mental health institute was very daunting. And then to say, and one of the first things we want to do is take on stigma as a challenge. You were so helpful in conceptualizing it as a grand challenge. I will confess, I was thinking of it as perhaps too big a challenge. Mm-hmm. Now, I've been happily proven wrong thoroughly about that, because what you were able to do through your deep understanding of social movements and how they build, you were able to bring organizations together around this common cause that quite honestly had not always gotten along well. In some cases, they viewed each other as competitors in the professional and healthcare mental health space. But through your early work and early convenings, it was just fascinating to me to see these sometimes competitive organizations with different agendas all agree to a person. I don't think there's been anybody who said, we just don't want to be involved. This doesn't mean anything to us. This is not important. That has not occurred. everybody's come to the table, put aside what might be their particular group's proprietary interest of any kind, and really join forces around this. And there were in individual organizations stigma-related efforts going on, but this has done what you taught me grand challenges do. It's synergized those efforts. It hasn't detracted from anybody's, and arguably it's actually made everybody's efforts more potent and created a kind of cohesiveness around the topic. That nothing illustrates that more than the fact that the Ad Council has come on board with their overall Love Your Mind campaign and been a great partner in this. It's truly amazing to be watching the Olympics or watching the Super Bowl and see an anti-stigma public service announcement displayed prominently. That is a game changer, to use a sports analogy.
Yeah. The work with the Ad Council has been tremendously rewarding and continues to be as they roll out more and more, and seeing, like, for example, they got 11 sports leagues involved. And sports, of course, is something that reaches easily across the hyper-partisanship that exists in America today. So that was tremendously exciting. It has been very special to see how organizations come together. And I think we all have deep wounds, scars, like you were talking about earlier, because either ourselves or our family members or people we love have had significant challenges. And I think that creates some kind of an anchor of compassion and a desire to act that we've been able to draw on.
Yeah, the power of shared experience, but it's stunning how thoroughly as a society we had compartmentalized those things away. Yeah. Just not talked about, not discussed, not acknowledged. You talk about the reluctance that public figures would have about sharing anything about their struggle with mental health and addiction. So I'm really feeling that we've crossed a kind of threshold, and you can tell me, but I would have to think that when a grand challenge is working, that it gains momentum. The flywheel starts turning more and more steadily. At least that's what I'm looking forward to seeing in the not in the near future, in the distant future.
Yeah, and another an early I guess key performance indicator, if you will, is that you see actions being taken that you're not taking, that you're not even aware of, like the USA Today insert, or like a surprise ad during the Super Bowl. And it's like someone else did that, and they didn't consult you, they didn't go through you, they're not even connected to you, and yet there it is. Those are the things that you look for. That's how you know you're being effective.
Yeah, it's a true cultural shift,
right?
That then plays out in a lot of different ways. One of the things I've been encouraged by is there's a lot of evidence that the mental health professions, and not just at the level of psychiatrists and psychologists, but advanced practice nurses working in mental health, lay counselors, that new programs, expanded programs are being brought online to fill the gap. Because as we increase awareness, the prevalence of these disorders is so high, that there's a lot of unmet need, a lot of unmet treatment. The availability of online healthcare is going to be transformational too. So there are a lot of cultural shifts occurring that I think bode well for the anti-stigma effort.
Yeah. Well, I was in a meeting this morning, our task force on marginalized communities, and we had representation from the Chinese community in San Francisco. We had a couple of Native American communities, one in Utah, one in Michigan. We had rural folks there, Black urban youth, urban women, These are all different groups. And I feel like we're not going to succeed unless we move into these spaces. And at the same time, we need representatives of these spaces to be working with us, because I'll never forget the ad council telling me the right message from the wrong mouth is the wrong message. And so it can't be me that goes into the Chinese community. It needs to be someone who is Chinese. And there they were on the Zoom call today. So that's true. I find that tremendously encouraging. That's a great source of hope for me when I see that level of participation.
Well, we continue to struggle with great inequities in America, and the inequities in healthcare are particularly glaring. And the communities you just described are the ones that have all too often been left out in the cold when it comes to much needed healthcare.
So when you look back over the last 3 or 4 years of what we've been building here, what stands out for you in terms of a kind of, in retrospect, some of the milestones?
Well, you had educated me early on about the importance of early face-to-face convenings. Mm-hmm. Now, this was all getting started at literally right after COVID had taken us away from interpersonal connections. One thing that stands out is the power of those early face-to-face meetings. And in many cases, they were still mask-to-mask meetings. But so it was that power of personal connection, of people really feeling like they were getting to know one another. And also, while Zoom has been a great tool, excuse me, it takes away some of those casual hallway conversations, or during a break, sitting outside with someone and having a conversation. So one thing that stands out is how important those early face-to-face convenings were. In hindsight, I think if those had happened remotely, I don't know that they would have held the power that they did. The other thing that stands out to me, I already mentioned, is sadly, in the healthcare world, the different professions, different specialties don't always get along. It just was so striking to see people that, again, in some ways were competitors with each other, not letting that get in the way of knowing that stigma was a huge issue that needed to be addressed, and we couldn't do it unless we were highly collaborative. In the business world, they use this phrase co-opetition. Oh, yeah. What I've seen with the initiative is people who in many ways are competitors setting that aside to cooperate. That is another striking thing to me. And then I never would have imagined what's happened with the Ad Council occurring. It certainly wasn't on my map early on. It's obviously a very potent tool. So, whether you believe in fate or serendipity, whatever it's been, there have been some happy connections that have really potentiated the effort, I think, much earlier and much more rapidly than might have occurred.
Yeah, when you were talking about co-opetition, which is not a word I'm that familiar with, but I can imagine the convergence of two words there. I'll never forget during our summit in June at an event where Rebecca Bagley, the CEO of the Kennedy Forum, stood up in front of the room and said to the audience there, I've just spent the last year fundraising, and I have met so many people. And if anybody in this room would like to know who I've met with or like a personal introduction, please come and see me. I mean, wow. Fundraising is usually the great divider. That's where competition really comes in. And here she was saying, come and talk to me and I'll share the resources that I have, to a room full of strangers, other than the fact that we're all invested in eliminating stigma around mental health.
Yeah. That you would never see that in the typical world of donor relations. People cling to their donors tenaciously. That was extraordinary.
Yeah. So as we stand where we are today, we're definitely not finished. The National Academies produced that report in 2016, where the expectation was around 20 years or so it would take to do this. What do you see? What are you looking towards in the future? Where do you see we have some real hills to climb or some challenges that are in front of us?
Well, obviously, we do live, as you alluded to earlier, in a highly partisan world, and we have a change in administration. The outgoing administration has been very supportive of mental health. Now, the incoming administration, it has not really laid out a clear view of health priorities, but that's a hurdle we have to get through. Another hurdle that we're already, I think, successfully negotiating is turnovers in leadership. I mean, these organizations that participate in Stop Stigma Together all have CEOs or presidents. Those positions turn over. But so far, so good in terms of the incoming individuals seeing the value of this and helping carry it forward. But that's always, I think, a major inflection point in an effort that's been so based upon personal positive interconnections. This is really at the highest level. It's the shifts in our culture about the way information is transmitted, about how influence is exerted, and of course, the challenges of disinformation and misinformation, which, is not going to get any better as technology advances, as artificial intelligence intrudes upon things, maybe for the better, maybe for the worse. All of these will be challenges. The world is not standing still.
That's right.
And so having the initiative adapt to those kinds of shifts in leadership, shifts in political leadership, shifts in the advancement of technology. But the base is sound. The base is very firm. We have a beachhead firmly established that we can move forward from. I think all those things are counteracted by just, if you can't measure passion, but you can feel it. And there's just so much passion on the part of so many participants in Stop Stigma Together. That's what will help us stay pushed forward.
Yep. Well, this has been wonderful, Darrell. Thank you for your time today.
It's always good to have coffee by the fireplace with you, Seth.
Well, I look forward to many more.
All right. Thank you for including me.
You bet. Take care. Bye-bye.